Leeds is such a brilliant city. It's the fastest growing city in the UK and it's got so much to offer, but not everybody has the same experience of the city. So depending on where you live, it's a very different picture, and that particularly plays out in health inequalities. People who are born into the poorer parts of the city live on average 12 years less than people who live in our richer neighbourhoods. And we've seen these health inequalities slightly growing over the last 10 to 15 years.
COVID had a great impact on people and people's mental health and well-being. Cost of living has impacted it even worse. We're seeing lots of families, people who can't make the money stretch.
We know that it's not inevitable. We know there are things we can do about it. And that's why we've decided as a city to work with Michael Marmot and his team to really step up the work we're doing around health inequalities.
Leeds approached us and said, we want to make Leeds a healthier place and we want to reduce health inequalities in Leeds. If people are suffering ill health through no fault of their own, we think that's wrong and we want to make a difference.
Ultimately, we are here to help people, and we can help people in the here and now with their issues. But hopefully, by doing that, that then has a positive contribution to those people moving forward.
The work that we're doing with the Marmot team is particularly looking at what's called the social determinants of health. So these are the wider factors, what's often called the building blocks of health. Unless people have these, there's very little chance of having good health.
There's a clear link between health inequalities and poverty and inequality. So the more that is exacerbated, the longer impact it has.
In my review of health inequalities, we had 8 domains of recommendations. Give every child the best start in life, education and lifelong learning, employment and working conditions. Number 4, everyone should have at least the minimum income necessary for a healthy life. Number 5, healthy and sustainable places in which to live and work, taking a social determinants approach to prevention, tackling racism, discrimination and their outcomes, and pursuing environmental sustainability and health equity together.
We have committed as a city to set ourselves 5-year targets and 10 years targets for the things we want to see change. We've picked 2 things to focus on in the first year. So we've got incredibly intensive work happening around health and housing.
People are recognising that poor housing quality affects people's health.
If you're living in a deprived area with a poor environment and your house is not adequate, then us as medical professionals will see higher levels of chest problems. We see high levels of vitamin D deficiency, for example.
There have been a whole forum of meetings now that are set up that are bringing together a wide range of professionals across health and housing, improving the partnership working incredibly.
The other priority at the moment is around best starts in life.
We know that having a good level of development, age 5, predicts how well the child does in school. And that in turn predicts the kind of income you have, kind of job you get, where you live, all of which are important for health. So it starts right at the beginning. To improve health and reduce health inequalities, you need action from early childhood, education, employment, benefits and income, housing, neighbourhoods, communities, transport. And the evidence from the places where we've been working is that they need collaboration between these groups so that they're not working at cross purposes.
We have a network of community hubs across Leeds. We offer a range of services from them, so access to council services, so if people need support with council tax or benefits or housing related activity, they can come here. Council does provide a lot of services and provides a lot of support for people, but we can't do it on our own. We wouldn't be able to do half and a quarter of the work we do if we didn't work in partnership and collaboration with our third sector colleagues.
It's about building trust for people to know that Leeds is working for them as well as we are working for Leeds in terms of health and well-being, being a happy and productive city. If we're working right and doing equitability around everything, then there will be a difference that can be seen but it takes in a lot of different elements. It takes in business being able to work, education, green spaces, climate change, all those things form part of being an equitable and a fairer space.
I'm really proud of the fact that the city was ambitious enough when it was coming out of COVID. We could see that inequalities were getting worse, and we made a really ambitious decision to become a Marmot place.
The positive reason for working with local government is they really care, they really want to make a difference. They've said, we're going to do the best we can with the money we have. I'm hopeful that we'll get a national commitment, and we've got widespread local commitment, and that the two will go together and we will make a difference.